You mentioned several times through this interview George Floyd. In that George Floyd case, I know you were brought on. I think it was through your friend Ben Crump, correct?
Yes.
I heard you make mention in earlier interviews that you believe that Derek Chauvin, the officer who was ultimately found guilty of his murder, he had his knee on his neck for over 9 minutes. But you believe that George was dead maybe 4 minutes into that. Why do you believe that?
Because he stopped. He had been talking out, and you can hear on the witness video that he's saying, "I can't breathe, I can't breathe." I think they counted 27 times that he may have said, "I can't breathe." He was moving around. He was trying to move his head and his back. And because he was moving around to try and breathe, because there was pressure on his back as well as on his neck, the officers thought that he was trying to get away. He said he's struggling to get away. He was struggling to be able to move his chest around so he could move his lungs and breathe. At about 4 minutes or so, 4 or 5 minutes into that situation, he stopped moving. He stopped talking, and that would be because he lost consciousness. And the kind of pressure that was put on him would mean that he would probably be dead within a minute or two afterwards. And then when they picked him up, the little bit that can see when they put him into the stretcher,
correct.
He was already in complete cardiac arrest, and he didn't respond to the CPR that was done in the ambulance. So George Floyd was dead before the ambulance people get there, and he was. They had him on the knee and all on him and the back pressure for 9 minutes, but he was dead and not moving, and his heart had stopped before the ambulance had gotten there.
You know, we hear cases, and you also mentioned earlier in this conversation, Eric Garner.
Yes.
You know, we hear these cases of people being put in rear naked chokes. George Floyd had a knee to the back of his neck. In general, how long would it take for someone to lose consciousness and ultimately lose life? Because if I can remember correctly, Eric Garner, he was put in that rear naked choke, but it wasn't nowhere near as long as George Floyd had the knee on the back of his neck. So could someone pass away within seconds or minutes?
Shawn, very good. Again, just like with George Floyd, it was the witness cell phone that contained a great deal of information about what happened, because the autopsy doesn't show the neck compression. With Eric Garner, there was also a young man who did a cell phone of the takedown of Eric Garner. And that video was on the internet. It was on the internet. And that video shows that from the time he was touched by the officer, there was a little bit of a discussion and confrontation. The officers tried to go after him. The first touching of him and putting an arm around his neck, to the time that they realize that he's motionless, that he's not resisting, and he's dead essentially, was about 48 seconds. You can see it on the video because there's a continuous video. And that's because in the video, there's the arm around the neck, the chokehold or yoke hold, and there was also pressure on his back, with two different ways in which it interferes with oxygen. And he also was a heavy person who had an enlarged heart. But The time when I started out, when there was an unruly person, when police in New York City responded to an unruly person and told him to put his hand behind his back, and he didn't comply, they would compress his neck with the arm across the neck or nightstick across the neck to try and interfere with his breathing until they got him to pass out so they could handcuff him. That is type of pressure on the neck that causes a lot of fractures and hemorrhage in the neck that you find at autopsy. And in trying to stop somebody from breathing with neck pressure, it takes a few minutes before the oxygen level goes down. But shortly after I started in the 70s, the Los Angeles Police Department developed what's called a carotid sleeper hold. That's instead of pressing on the front of the neck, the arm can be put around the sides of the neck. The elbow, crooked elbow, goes across the windpipe, so it doesn't compress the windpipe. But there's pressure from the arm and forearm against the sides of the neck that, when it's done properly, compresses the carotid arteries, the artery that you try to get a blood pressure from, with tight pressure against, in that carotid sleeper hold, the triangulation hold, the pressure of the neck prevents any blood from going to the brain. If you can cut off the brain quickly, the blood going to the brain, the person will lose consciousness within 8 seconds, 8 or 10 seconds. So that a blockage of the airflow in the front takes time and struggle. Blockage to the blood flow to the brain happens in seconds. The reason for that is the oxygen needs continuous blood supply. Cut off the carotid arteries, and the person passes out right away. If you cut off the breath supply, the oxygen in the blood can continue to nourish the brain, even if you hold your breath or underwater swimming for 2 or 3 minutes in some people. But because there's still oxygen going to the brain if you can't breathe, but there's no oxygen if you do it on compressing the blood vessels in the side of the neck. And so a carotid sleeper hold can lose consciousness within less than 10 seconds. If you leave it on for a longer time, that can cause brain damage or death. And so the police, the idea of the carotid chokehold is to get the person unconscious and to immediately put the handcuffs on and take the pressure off the neck so the person can start, the blood flow can start circulating again. That also happens with tasers. The idea of the taser is the person will lose consciousness for enough seconds to put the handcuffs on, but if you do it too long, it can cause other harm.
Got you. Okay, before I let you go, I'm looking at your new book, American Autopsy. Why now? Why, after all of these years of doing what you do, did you find the need to write this particular book? And in your many years of practicing, what have you learned about death itself?
Well, one of the things I can appreciate about death itself over time, to answer that first, is there's a popular thought that people ask me, how can you do medical examiners work on dead bodies? Isn't that a horrible the way to be a doctor? When I worked at Bellevue Hospital as an intern resident in internal medicine, the hardest part of death to me as a doctor was treating patients who are in the process of dying, often from things like cancer, and not being able to help the patient, not be able to change things. and to participate in the loss of life that can be so upsetting. Treating the patient was much more upsetting to me than seeing the dead body. The dead body has no pain, no suffering, and is there for us to learn something, to help the family know something about the cause of death, to help the police and prosecutor to know what the causes of death were in unnatural deaths, homicides, suicides, to tell them what the situation is, but not necessarily to agree with them. So death is inevitable, and the problem is as we get older, as medicine has gotten better, as sanitation has gotten better, as eating has gotten better, everybody is living longer than they used to live. So the benefits of long life is we can see our kids, our family, enjoy things more, but at the same time we get sicker more. There's much hip. Today, I think the most common surgical procedure are curing hip problems due to arthritis and hip surgery. As we get older, which wasn't a problem when we had younger people. As far as why I started the book, I've thought in the past since I became chief medical examiner and saw how quickly the police get upset if you don't find things in their favor. I've learned that there is a lot, when police deaths occur, there are a lot of pressures on medical examiners to find causes of death that are helpful to police, that may or may not be valid. And that when Floyd died, it was so obvious to me from just the video that's shown that this was a typical kind of compression, asphyxial death, for the fact that he was calling out that I can't breathe, as Eric Garner called out, I can't breathe, and others, that when Crump called me, even though I was in isolation from COVID, I felt this was an important enough matter to come down, and because the blame was being put on drugs and heart disease, rather than that was painfully obvious to the witnesses who were there saying you're killing him, and to what was on the video, that this was an important case, and that this was sort of a culmination of things that I had learned over the previous 40 years or so, that often police misjudge what causes of death are when people die in police custody and after in police altercations. So when I returned after I thought if I was going to write a book about it, this is the time to do it. This is COVID. That clearly all deaths have to be reported in police action, have to be looked at in police altercations, and that there has to be some kind of national register that where all deaths in police altercations have to be looked at, because often, as Tyre Nichols show, the police give false information initially as to how the deaths occur, that the prosecutors go along with what the police say. There's a bias toward police among medical examiners and coroners in their favor, and that the families only find out about these things sometimes when eventually a video is released of what really happened, as with the Green case. So that I think it's important, and that there's a lot of misinformation now in the media about deaths in police custody. that when we have a case like a person beaten up after a car chase and beaten to death, that happened in the Green case, and then it's called on a death certificate automobile accident, there's no way that can be recovered from doing searches on death certificates or looking at police reports. It has to be done independently, where all deaths in custody are looked at. There'll be a few thousand deaths a year. This would be something easy to look at, but it would be important to do that so that there'll be some central knowledge of all the deaths occur by shooting as well as during the restraint process, and that then strategies can be worked out to prevent the deaths. There should never be compression of the neck. There have to be proper videos. Tyre Nichols showed there should be pole videos on pole higher up, so that captures the whole death scene rather than just the body cams that are helpful, but that can be turned off easily by officers, as with Tyre, who don't want things to be shown on video, and that there can be strategies developed to prevent deaths from altercations with police caused by police, or cleared that police didn't have anything to do with it, if there's enough documentation of what happened, not relying on the documentation only coming from what the police say happened.
Well, thank you so much. This has been an extremely fascinating conversation. I've learned so much just sitting and listening to you speak. You have done great work, and I love the stance that you've taken early in your career. And I think that if I got this correct, you called it the three-legged stool, where the police, the prosecution, and the medical examiner usually work as one. And you made a decision. Look, my job is to get to the truth. No matter, it's you guys' job to figure out who did it. I'm just telling the truth. And that's what's most important to me. So I thank you so much for even, not falling victim to a system that really has worked against so many poor and disenfranchised people since the beginning of time. So thank you.
And this is all discussed in this book that just came out.
Where can we find that book, Dr. Baden?
It should be in all bookstores, but it's certainly on Amazon. Amazon is the easiest way to get it.
Okay. American Autopsy. It is a must read. I will be going and get my copy immediately. Thank you so much.
Thank you, Shawn. Good to talk to you.
Likewise.